Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert, and I am here today with my ultra faithful and very, very loyal, de-humped podcast partner, Dr. Millicent Rovelo. How are you?
I'm good. How are you?
You have been de-humped.
I have been de-humped. Although, to be fair, I don't know that I had much of a hump.
No, yours was like a very, very minor excuse for a hump.
But for the uninitiated, we are talking about humps, not to be confused with lovely lady lumps.
That's different.
That is different. We are talking about the nose variety of humps.
Right. And these humps cause a lot of problems for a lot of people, and it's why many patients come in for rhinoplasty.
Yes, it's probably up there with problems breathing and just overall size issues. I want to get rid of this hump.
Yeah, I think dorsal hump is probably my number one reason for rhinoplasty.
Right. Because if there's anyone out there that isn't aware, a hump on the nose is what you would see usually in someone's profile, where right around like the mid portion of the nose, there's a hump. Like, I don't know how else to describe it.
Right. And anatomically, typically it's the area where the nasal bones meet the cartilage middle vault of the nose, that portion of the nose that goes between the bones and the tip of the nose. And it's when they're big, and nobody likes them.
And which is interesting, right? Like, why are we so obsessed and concerned with having a straight line from the forehead down to the nose? Like, we want that line from the radix, which is like the deepest part of the nose, right in between the eyes, to the tip to be a straight line. I should clarify, in our culture, that seems to be something that is preferred. But I think that there are some cultures where humps are very much not a problem.
Yeah. I mean, so the reason that people do not like their humps is because it does a couple of things. First of all, it kind of ruins their 3/4 view. It definitely ruins their profile, but nobody like walks into a room in profile. I say that all the time. They always walk in straight on. So straight on, most people aren't bothered by their humps, but as soon as they turn their head one way or the other, it is unattractive. It becomes the focus of their face. And again, half the reason I operate on noses is to make them not seen, not the focal point of the face, to make them blend with the other structures so that you see the big, beautiful eyes and that you see the cheekbones. So getting rid of the hump takes it away as a full sort of in-your-face frontal assault of aesthetic mischief. Really, it's just harmony. Not good. Yeah, it's not good. So by getting rid of it, and for men, most men want a straight line dorsum. They might even like to have a little residual hump. And for women, they tend to want a little hint of a curve or a straight line. There are some, people that want like scoopy noses. I don't do that, so I don't want to sit here and say, oh, I'll definitely scoop your nose out if you ask me to. I have some on my website that are that way from days of yore. And I don't like them. So it's not really an option. I like to have a gentle hint of a curve or something along those lines. And so getting rid of the hump really makes the nose more beautiful, but it makes the person's beauty come out a lot more.
So I guess the question that I've heard battered around, do I need a formal rhinoplasty, or can you just shave the hump down?
Well, there's a couple of ways to do it. First of all, you can just take care of the hump, but you still have to do a rhinoplasty because you have to make everything else blend. And this is where I think preservation rhinoplasty is a good option. If they don't have a whole lot of a hump, but they just need the dorsum to come into the face, then a preservation is a good way to go. Typically, though, that can make the nose look wider. You can get some residual hump. And so there's some downsides to doing the preservation. For me, I like to just take the hump off with power tools, rasps, whatever, just to get it down to the right height. And then with the cartilaginous portion of the hump, take that off with a knife and then blend it by reconstructing the middle vault. In general, this works very well. It's pretty routine for me. I've done over 5,000 rhinoplasties. It's not a big deal. I think people who are starting out struggle with the dorsum. I really do. I think it's a very hard part of the operation, and taking a hump off is not trivial, and it has to be done correctly. You can get flail segments of bones, destabilized portions of the nose, problems with disjunction at the cartilaginous bony junction. So it is tricky, but in experienced hands, it's kind of routine, and boy, does it look great.
But would you ever just do the hump?
Yeah, I
And
do.
not touch the tip, not do the bones, just cut, shave, rasp off the hump, close up your incisions, call it a day.
Yeah, you can do that in very minor situations. You can. It's harder. Because again, as soon as you take down the hump, you have to think about it like a pyramid. So when you take off the top of this triangular sort of 3D pyramidal structure, if you don't move the bones in, it's going to look wider, right? This is
Right.
the argument against preservation, because like I have about 3 or 4 post preservation rhinoplasty patients right now that their complaint is that they have, number one, a residual hump, and that the nose is too wide. So that's predictable based on the technique. With taking the hump down, you still have to do something. I mean, you can't just shave off, some bone and be done with it. I think that's sort of that's how patients would like to think it could be done. Like it's like Legos, like just take this part off and then we can reconnect everything and it'll be fine. But the truth is that as soon as you take the hump off, you're changing the dynamics of the way that the nose looks on the face. And so ultimately you probably have to do some slimming procedures, depending, of course. Every patient's different. Every patient has a different request. So I think customization is the number one approach to getting this right for the patient. And I just think, from my standpoint, you have to have all the techniques at your beck and call, so that you can call upon the technique that's going to give the best result. And whether that's, just a component reduction, just taking the hump off as a unit, doing a push down or a let down preservation technique where you're not even touching the hump, you're just pushing it, down into the face more. These are all sort of the approaches to get rid of the hump. And a lot of times there's some crookedness to the hump too that you have to play in. And again, this is where I find being able to control that with grafting and with with all the techniques that with composite, with component reduction and the reconstruction, it makes it much more easy, much easier to kind of get the great result.
Right. Yeah, that definitely makes sense. And do these humps grow back?
Depends how you take it down. You can get scar tissue, you can get bony, sort of proud bone kind of callus that grows on there onto the operated, the now straight or kind of curvy bridge. If you get some bone growth, it can come back up for sure. And I've seen that. I had a patient she had like a major league hump, took it down. She did great. It's on the website, the whole deal. 5 years later, she's like, I think my hump's coming back. And it wasn't that she was growing bone. She was actually getting scar tissue that sort of whirled up and got kind of thick. And so we just literally had to take out a little bit of scar tissue under local anesthesia. But it was 5 years after her rhinoplasty.
I wonder if that's because she had an exceptionally large hump.
Maybe. I think that I think there's periosteum and perichondrium that are sort of left over or that grow back, and they can make tissue.
Yeah, of course. Well, that's really interesting. So humps are a problem. Nobody likes them.
No.
They can be removed, but you do need a real rhinoplasty. It's not something we're just gonna like shave off in the office and send you on your way.
No. I mean, that's the dream, isn't it? Right? It's like, oh, can you just like do a little of this and I'll be good? But it's not that way, just because of the dynamic nature of the way that everything you like. And I use this analogy. it's like when you're trying to set up a tent. I don't know if our listeners have ever set up a tent, but you have like four
Has your
poles.
co-host ever set up a tent?
Have you ever set up a tent?
Never in my life.
Okay. So what happens when you're setting up a tent and you're trying to get I mean, now you kind of like hit a button and they just go right up. But back in the day, you had to get the poles to kind of balance in tension with each other so that you could get the right shape for the tent. And a nose is a lot like that, where if you push one thing, it pulls another thing. If you pull one thing, it pushes another. And so the structure will kind of vary based on what you do to the whatever aspect it is of that pyramidal structure. So when you take off the hump, you've made a wider nose. You have to narrow the bones, otherwise you have a wide nose. And I'm telling you, like this is going to be a thing for me now. I mean, I guess I should start writing about how to revise the preservation rhinoplasty, because the revisions are a little different, but they do have similar complaints. They do talk about residual humps and they don't like the width. And that's the problem, because like, if you think about it, okay, here's your hump. And so it's this wide here. Well, if you cut the bones all the way around and just push it down, well, now you have a shorter distance to get to that width, right? So it's like you by the very nature of how you reduced that hump, you're still going to have width. And it's just going to be closer to your face, but wider.
But wider, right? Simple principles of geometry.
Right. So as long as your patient is okay with that, like if they have an ultra thin nose, they'll probably be okay with a little bit of width. But the 3 patients, and I've got a 4th one that doesn't know if they had a preservation, but looking at it looks like they did. These patients all are complaining about the same things. And they were done by different surgeons with the same technique. They were all done with a high septal strip and a push down technique, which is not a big deal again. But for me to correct it now, I have a little bit of a different, situation. Obviously it can be done, not the end of the world at all. But it's just different. And, I figured I'd be coming up on more of these, which I have. And in fact, one of my patient's daughters had a preservation done. And I remember it was one of the first ones I corrected. And I got in there and it said very specifically that the middle vault was not touched, et cetera. And she was like, I had this operation and my nose is so wide now, I don't know what happened. And I was like, oh, he must have put spreader grafts or something like that. But it was actually a preservation, and it wasn't kind of stated as such in the operative note. And maybe I just didn't know what I was looking for back then. That was probably about 5-6 years ago. But, revising it was a little trickier. I just had to put more structure to kind of stabilize everything.
Right. Well, that's certainly something you need to talk to your surgeon about. Whether or not you're going to, what you're going to have afterwards is very important, for sure.
Yeah, you don't want wider noses in general.
A few small percentage of patients benefit from wider noses, but in general, I think the average person wants their nose to be a little bit slimmer.
For sure. Or keep the same width, just, get rid of the hump.
Right. So here's a very loaded question for you. So you have that person who literally just wants their hump gone. They don't want to have a rhinoplasty. Should they put a filler in their nose?
Well, if you're going to camouflage the hump, I mean, you have to just be okay with having a bigger nose, right? Because the way that you camouflage the hump, which we just did for one of the nurses in our office, we put some filler in the radix, blended it a little bit at the super tip, and it hid the hump. So, you can do that, but you do have to be okay with a bigger nose. Yeah.
And a potential filler complication.
Well, sure. I mean, fillers need to be done by experts. I mean, if you get into an artery, I mean, I've seen a lot of dead nose parts from fillers. So yeah, I do not take it lightly when I do nose filler, and no one should, because all it takes is to get that needle into one of the branches of the angular artery or the angular artery itself, and you can have, dead portions of the nose. And this is why, like in revision rhinoplasty, I'm very hesitant to use filler.
Right.
You don't know where anything is.
You don't know where the normal anatomy is. It's all been distorted. And the thing with the nose is it doesn't have a lot of great collateral blood supply.
No.
Some portions of the face get blood supply from multiple areas. The nose, some areas only have one vessel supplying it. And if you knock off that one vessel, well, then you're kind of toast. And now you're looking at a dead tip of your nose, which is going to be a disaster. So in general, fillers, go to someone with expertise. But I say, if you're going to have someone inject your nose, this is where you probably want to have a surgeon, a plastic surgeon or a facial plastic surgeon that is very familiar with the anatomy of the nose, that looks at it on a regular basis from the inside out, not a nurse injector that's never done a cadaver lab or touched a nose or done surgery on the nose before, because this is where things can get really, really tricky.
Yeah, that's for sure. And again, taking the hump off during a rhinoplasty is pretty routine. We do it all the time. We can make it look really nice. Are there problems with it? Yeah, we talked about it. You can get some lumps, bumps, things that need a little extra shaving, usually stuff you can do under local. Very rare I got to take somebody back to the operating room to do any kind of tweaking for them. It's usually an office thing, and it's 5-10% of the time something needs a little modification in any rhinoplasty. In my practice, the national average is 15% all comers. So there's something to be said for experience and expertise in doing rhinoplasty, especially for a dorsal hump.
Right, for sure. And then some of the things are just unpredictable in terms of how things are going to heal. Now, certainly during surgery, steps are done to make sure that we counteract certain effects of healing and scarring. But sometimes things just, they're going to scar in a weird way. You need a little tweak in some kind.
Yeah, and that's the thing. That's why Wednesday is one of my favorite days to operate, because it is hump
day.
Oh
I think
yeah.
that's everyone's favorite day.
It is. It's a good day to get rid of a hump. Well, I think that's just sort of the basic concepts of it. There's a lot more. I think if you go to our Rhinoplasty 101 podcast, and then we had sort of an intro to rhinoplasty podcast. We talked a lot about dorsal humps, and a few of our patient experiences were about humps too. So plenty of information here on the Beverly Hills Plastic Surgery Podcast. But for now, this is the Beverly Hills Plastic Surgery Podcast, coming to you from the 90210.